Morning, I'm Garcia from Orthopedic Specialist Seattle. I'm one of the sports shoulder surgeons here, and today we're going to discuss Tommy John surgeries. So Tommy John ligament is important to understand. It's been hot in the news lately, especially with the World Series going on. And the first thing to understand about the Tommy John ligament is the anatomy, and so we have an anatomic figure right here for you to better understand that. So again, this is the inside of the elbow. This is the Tommy John ligament right here. This is the one that you hear a lot about reconstructions in the news. This is the ulnar nerve, which goes along the back here, and that's important to understand as well as how it relates to the Tommy John ligament. And third, what's not shown here is the flexor tendon attachment, or the flexor wad, and this can be strained in baseball players, etc. And so these three pathologies, or these three parts of the anatomy, are important to understand because they all kind of come together, and they're part of our diagnosis to understand what's going on with the player's arm. In general, the Tommy John ligament was named after Tommy John, the famous baseball player who was the first one to have this reconstruction. And before this, when players had this type of injury, there was no option for them, so they basically were done with baseball forever. It's important to understand there's two main types of people that get injured. One is the general population, and generally that's from an elbow dislocation or a traumatic injury horsing around with friends. And usually when this happens in the general population, we try to rest and rehab. There's usually no surgery needed. Now for throwers, when they have this is generally a perpetual throwing motion that causes small tears and either complete tears or eventual partial tears that they can't throw anymore. And these are the ones we consider about surgery. So talking more of the throwers, since that's the more complex area, there's the main etiology of this is repetitive throwing, as I mentioned. And in general, this happens in a number of different players. It doesn't just happen in pitchers. It can happen in all position players for baseball, quarterbacks, and high-level javelin throwers. And again, it's important to understand the symptoms of this. Generally, the players describe it as elbow pain or pain that has a dead arm, and usually they describe it as a loss of velocity or a loss of speed. In general, when I see these players, we consider an x-ray or physical exam first to see if they have an injury. If I have a finding that there's a partial injury or a flexor strain, then I want to try 6 weeks of no throwing and complete rest. If I'm really concerned they have a full tear of their ligament, then we'll consider an MRI. If the players who have gone through the 6 weeks of rest still continue to have problems, that's when we consider getting an MRI with dye in the joint. Now, of the two options that we can find with regards to damage to the inside ligament, there's a partial tear and there's full tears. If they have a full tear, we go straight to surgery. If they have a partial tear, we consider PRP injections, which have shown very high and good results in return to sport for these types of players. Now, going back to this overall, understanding that for the two types of ligament injuries, the partial tear, we again try the rest and the PRP. If that fails, then we proceed to surgery. And then with the full ligaments, we proceed to surgery right away. Now with regards to surgery, there's two main types of surgeries. The first surgery is the sort of original surgery, the Tommy John reconstruction, and this is mainly for full ligament tears in pitchers. So when they tear this ligament, we try to reconstruct it with a tendon from the patient's hamstring in their knee, or from their elbow or hand right here. This reconstruction does quite well with a 90% return to sport. The only negative of it is it's around a 12 to 18 month recovery. And this is really why we've invented the next technique, which we'll talk about, which is a repair with an internal brace. So for players that have partial injuries, who are not in the professional level, or for people who have a full tear that are quarterbacks or other levels of positions that are not pitchers, we try to repair the ligament and then back it up with this synthetic suture that's collagen impregnated, and that's called the internal brace. And this backup brace allows players to get back to sports in around 4 to 5 months of throwing, which is pretty impressive, and around 3 times faster than the reconstruction. Again, this has been revolutionary to playing baseball and to all these throwing sports, because we can get players back towards the end of the season if they injure at the beginning, which is an impressive statistic. In general, it's also important to understand that one of the complications of these surgeries is having numbness in your hands. So if players have numbness before they throw, we try to do what we call is moving the funny bone nerve or the ulnar nerve that I showed you in the anatomy, and that can prevent that complication and prevent people from having that numbness in throwing that they had before the surgery. Again, it's important to understand that throwers in general have a complex algorithm to diagnose their elbow pain. Not all people with elbow pain have a UCL tear, but that's why you need to go to a surgeon that specializes not only in these athletes, but in these surgeries. If you or someone you know has this type of injury, visit my website at www.grantgarciamd.com or search for us at Orthopedic Specialist of Seattle. Thanks.